Welcome. Commonly known as brain fog. Many emails just piling in, claiming that they have lightheadedness, fogginess, just loss of retention, just not there. You feel like something is lacking. Now, I want you to look back to your particular day, maybe your last week, last month, things that you do every day. If your head is in a forward head posture like this, you're putting excessive stress on muscles, ligaments, and ultimately nerves. And nerves, as I'm about to show you, can play funny games in your body. But realize you have many muscles behind the back of the neck area that attach up behind the skull. Now, underneath the back of the skull, there are delicate nerves that run back into the facial area, back around the ears, back into the glands. And these nerves can play funny games with your body when there's inflammation and irritation underneath the suboccipital, or the base of the skull, as well as the upper cervical region. The atlas, which is the first bone here, and the axis, which is the second bone. As we look up here, as we affect nerves in the upper cervical region, that can affect everything in the entire body, all the viscera, the organs, the tissues. As we come right below the skull, it can affect over the head, actually behind the eyes. So when people have fogginess, or their eyes may feel like it's not real clear or something's just not right, I want you to understand that nerves can play a lot of funny games. And when these nerves are being affected from these particular muscles, because there's irritation underneath that region, we can then start a whole episode of symptoms. So because of the complexity of the nervous system, that when nerves are affected underneath the skull or in the upper cervical region, that has an effect on the entire system of the body. Because in order for the energy from the brain to come down into the spine, it has to travel through this upper cervical area first. So looking at your head, looking down in a forward head posture, anterior head carriage, when the head is in a forward position for long periods of time, these muscles then start to contract and pull behind the occipital area. These upper trap muscles attach at the EOP, the external occipital protuberance, and inflammation underneath the skull can affect the greater occipital nerve roots, and these nerve roots can affect over the head behind the eyes. So I'm going to ask you to be aware of that forward head posture. Using ice underneath the skull can reduce a lot of that fogginess because it will reduce the inflammation. Occipital stretches, taking your hand, putting your chin down and pulling it forward and holding it there 20 to 25 seconds. Turning your chin to the left and pulling it down again. 20-25 seconds. Turning your chin to the right onto your chest and pulling it down again. 20-25 seconds. Releasing those suboccipital muscles. The most important thing is to keep your chin inwards when looking down. The further you bring your head forward, for every inch, your head weighs 12 pounds, for every inch is an additional 10 pounds. For every inch going forward, 1 inch is 22 pounds, 2 inches, 32 pounds, 3 inches, 42 pounds. And at 60 degrees, it's like 60 pounds of stress that the back of the neck and shoulders are holding up. It's like a young child. It's like 4 bowling balls that the back of those neck muscles are trying to withstand. So if you're putting stress on these areas, the nerves are going to become inflamed, causing erratic, sporadic symptoms that most physicians are not going to be able to pinpoint. MRIs, X-rays are not going to pinpoint it because of the inflammatory changes that's occurring on those nerve roots. So get back to good posture, good biomechanics. Check my other videos out when it comes to good posture, and I think it will really make a big difference in your future. I ask you to share this video with others, and most important, make it a great day. I'm Dr. Alan Mandell.
Thank you.